for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
So that's where I look over there.
We got it. Hello, South Florida and beyond. Welcome to the You and Your Doctor Show, living a longer and healthier life. I'm going to get right to it tonight because we actually have two orthopedic surgeons on the program. We're going to start with Dr. Tom Minas. He's at the Paley Institute, which is in West Palm Beach, right up the road. Also part of Tenet Florida Physician Services. Dr. Minas comes to us from Boston, our friends in Boston. So he is professor of orthopedics emeritus at Harvard Medical School. So, Dr. Minas, welcome to the program. How are you doing this evening?
Great, David. Thanks for having me.
And thank you for driving down to Boca Raton and taking us on this adventure of health, because I wanted to have you on. I've never had a physician on who specializes in such a unique specialty as you do, and I want to get right into it. So you're an orthopedic surgeon, but what is this unique specialty? And I'll let you tell us.
Right. So I initially trained as a trauma surgeon in the late 80s, and the big problem with doing trauma surgery is that when you fix joints that are damaged by trauma, the holy grail is the cartilage on the surface of the joint. And if that's damaged, it inevitably leads to arthritis, even if it's perfectly reconstructed and fixed. So I had the thought back in the 80s that is it possible for us to do something which everybody has said can't be done, and that is grow cartilage. And so I started doing a lot of research on looking into if that was possible, found some early work in the 70s that was done in animals. And when I finished my fellowship at the Brigham and Women's Hospital in Boston in '89, I was introduced to Dr. Clem Sledge, who introduced me to Professor Green, who is a scientist in Boston who is growing human cartilage. And so that was pretty cool. It was just being grown, but it wasn't being put back into people's knees. So we did a series of experiments in animals, and we proved that it could be done. And then I found out about this Swede who apparently had been doing this unbeknownst to me in Sweden, and actually had done the first human transplant in 1987. And so having found that out, I got on a plane and I flew to Sweden in '94. And I met him. We became fast friends. We were both hockey players. I played in Canada. He played in Sweden. He played for the Swedish national team. I never played for the Canadian national team, but I enjoyed my hockey. And so we started talking hockey. He took me to watch the fastest sport in the world, which is bandy. And bandy is played on a soccer field, and it's completely a sheet of ice, played with hockey equipment and with Indian rubber balls and field hockey sticks. And it's played across all of northern Scandinavia and Siberia. And so he had two bandy players that he had transplanted their knees who had devastating injuries. And when I examined their knees, they were like normal knees. And I was blown away because I had tried another technique to transplant cartilage in damaged knees using your own rib cartilage, which was also a technique that was just starting to happen and I'd never had results as good as what he had done. And what he had done was he did a 2-stage procedure whereby he first would evaluate the knee on a day surgical arthroscopy, much like we have now. That's pretty standard. 2 small little incisions, look inside the knee, day surgery procedure, and he would evaluate the damaged area in the joint. And if it was like a large area of just isolated damage, like a big pothole, then he could fill that with laboratory-grown cartilage. And the way he did that was he would take a small piece from that same damaged knee, about the size of 3 Tic Tacs, or what I tell my patients, the size of a thumbnail clipping. And that would get sent to the lab, and it would be just chopped up small little pieces and then digested, and the cells freed. And now that they're out of their hard casing, they have the opportunity to grow. So they're put in a culture media in the perfect environment in the laboratory setting, and they grow, and then you can then grow them to whatever volume you take. So you take maybe 10,000 cells, and that's those 3 small pieces. You can grow them up to 60 million cells.
Whoa.
So the average transplant is about probably 20 million cells taken from 10,000 cells. And so the second operation will be done as an open saw operation, usually 4 to 6 weeks later. You would open up the knee as a more of a major surgery, and you would then cut away all the damaged tissue. You'd get a small membrane off the upper end of the shin bone, and you'd microsuture this to the surface, and then you'd inject the cells underneath, and then protect the knee after surgery with partial weight bearing, crutches, movement, make sure the knee doesn't get stiff. And in about 6 weeks, the tissue would grow to fill up the defect like a gelatin. By about 3 to 4 months, the pain would start going away. It would form the consistency of like a putty. And by about 6 to 9 months, it would be like a porcelain glass. And that's what normal cartilage is like. So it takes about 9 months to get to the stage where the tissue is hard in smaller defects. And that's when we let people start running again and starting to participate in sports. And by 18 months, they're pretty much back to all sports. So
Wow.
I saw that there. I was blown away by it, and I said, I have to bring this back to the U.S. So in '95, we got our institutional review board at the hospital to approve it. We did our first transplants in March of 1995, and since then I've done over 1,000 transplants.
Wow.
1,000 patients. And what's exciting is we just looked at our 20-year results now of the first group of patients we did, and they were transplanted for mostly sports-related injuries that resulted in very badly damaged cartilage, things like ACL injuries, taking out the meniscus at a young age, their shock absorber, malalignment of the leg, maltracking of the kneecap and dislocations of the kneecap, those type of things that we see very much in young athletes. And we had 80% of them who wished to avoid knee replacement 20 years ago have still avoided knee replacement for large areas of damage, much more than people thought would be possible. So it's pretty cool stuff.
Yeah, that's great numbers. Congratulations. That's 8 out of 10.
It is.
And
Yeah.
one of the things we were talking about early on when we first met
Sure.
was to avoid a knee replacement, because I didn't know this, but knee replacements can run out after a certain amount of years. You may need another one.
Absolutely.
It's not a one and done sometimes.
No, I mean, we'd love it to be one and done, but the thing about knee replacements, they were developed in order just to alleviate people's pain and suffering in the elderly initially who had advanced osteoarthritis. And that eventually became a standard of care by the 1980s, 1990s. The early problems with knee replacements were infections and having to have them taken out, and early loosening of the implants. And then the results started becoming quite predictable in the 80s and 90s, where we could get rid of pain and swelling and suffering. But then people started to think, well, geez, maybe if we can do it in the elderly, we can start doing it in younger patients. But, the problem is that the implants have 2 weak points. One is bonding to the bone, and the second is the wearing of the plastic. And actually the third is the plastic wear particles can cause inflammation and destruction of bone. So long-term plastic wear can lead to inflammation in the joint, enzymes being released in the joint that then resorb bone and cause failure of the implant. So these were problems that we started seeing, in young patients. Not so much our elderly patients. Our elderly patients, you put them in their 60s and 70s, they'd go for the rest of their life most of the time. But when you start putting them in patients in their 50s and their 40s, we started seeing early failures and high patient dissatisfaction rate. We saw dissatisfaction in up to 50% of patients undergoing knee replacement in their 40s and 50s. High failure rates requiring revisions, having to have the knee done over again, taking out the old one, putting a new one. Every time you take out an old one, there's more bone removed, there's less to work with. The implants had to become more sophisticated to do revision surgery, redos, and so the results not as good. And if somebody were to have a disabling infection in the middle of all of that, it could be a real problem.
Definitely, and I was thinking about this last night at my Seaway Patio Villas HOA meeting. I'm actually on the HOA board, and we have to put a new gate in, and one of the members was saying, yeah, it's aluminum. You can't keep on welding aluminum again and again. Eventually, even though it's a quick fix, it's just not going to adhere to it, adhesive to it. And I thought of a little bit about what you were just saying. Like, if you keep on doing the same surgery over and over again, the results, may not be the same. Kind of what you were getting at right there.
Exactly.
That's a little real life scenario I put to myself.
We all need a comparison for sure.
Yeah. And Dr. Myers, you might wonder what I'm doing over here, but we're on Facebook Live. We're on All County Healthcare Incorporated's Facebook Live page. So if you ever want to see this show, you can check on All County Healthcare INC. We're also on the iHeartRadio app. And if you want to call in, I have Dr. Myers here until 6:30. The number's 1-888-565-1470. And I learned something new tonight. I didn't know anything about bandy. So were those early athletes with playing the sport of bandy with the doc? Could you mention his name again, the Swedish doctor?
Sure. So my mentor and the guy who developed this is Dr. Lars Peterson.
Got
and
it.
He's out of Gothenburg, Sweden. We just had a jubilee in Gothenburg, Sweden with the International Cartilage Repair Society this past June. When it was the 30th anniversary of the first transplant patient in 1987, and Dr. Peterson's sort of formal acknowledgement of what he did. We actually felt it was so important, we submitted his name and his team's name to those very special awards in Copenhagen that happened for some reason just leaving my mind. Unfortunately, he wasn't nominated for one.
Oh, okay. Well, and I had never, like I said, heard of the sport of bandy. So those players early on were able to get back on the ice after. You said sometimes it takes a little while to recover from this type of repair, right? You're talking
Right.
4 months. I'm kind of.
So to get back to just life, just walking comfortably, we're looking at 4 to 5 months because the tissue has to grow inside your knee. And by the time it starts to get hard and attach well to the bone, we're looking at closer to 9 to 12 months. So that first year, we're really holding people back from activities. We're protecting them from damaging their knee joint as the tissue's regenerating and growing inside their knee. So the first year is things like walking, hiking, swimming, rollerblading, bicycling, and then we let them start doing things like outdoor jogging, 12 to 14 months, and then if their knee is tolerating that, and we usually get an MRI scan at 1 year to see that the cartilage and bone are healing normally, that we let them start pivoting sports like tennis and soccer and basketball at about 18 months. And pretty much just set them free at about 2 years to do anything they want.
Because that's strengthened.
Because by then, the cartilage is hard, the bone is attached well, and their muscles are supportive enough to protect their knee. Remember, we need good, strong muscles around our knee to support the knee. So at first, because we're protecting the knee from damaging itself, the muscles get quite atrophied and weak. And so year 2 is all about muscle recovery.
Okay. We're here with Dr. Tom Myers. He's the director of Cartilage Repair Center at the Paley Orthopaedic and Spine Institute. That's at St. Mary's Medical Center. You're familiar with that hospital, Level 1 Trauma Center in Palm Beach County. And Dr. Myers' office is there, paleyinstitute.org. Dr. Minas, hold that thought. We're going to take a quick break, and on the other side, I'm going to ask Dr. Minas who is a candidate for cartilage repair, and we're going to go in a little bit about the age range on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back. Thank you. We're with Dr. Tom Minas, Director of Cartilage Repair Center at the Paley Orthopaedic and Spine Institute at St. Mary's Medical Center. I will give out his office info before he leaves us. Before we broke, we were stumped there at the prize that the Dr. Lars Peterson was up for. And you said that actually your Cartilage Society, can you mention the name of that again?
Sure. So it's the International Cartilage Repair Society, which has about 1,200 members internationally. And we meet to update and exchange ideas and knowledge about the direction of joint preservation with cartilage repair and regeneration. So in any case, we had internally a meeting that we felt that his contribution to a society was so important, and to the field of orthopedics, that we internally nominated and wrote a letter to the Nobel Peace Prize Committee to see if he could get one in medicine, but they didn't bite. But we thought he was worthy. There was no doubt about it, and we still do. So I don't know if they take nominations more than once, but I think we should do it again.
I think they should. I'll tell you that. And that must have been a neat process, just seeing how that works, though. Just nominate. I wouldn't have known how to start with to get someone nominated for a Nobel Prize.
We did a little bit of research to find that one out, for sure.
Tell us the fun fact about Nobel, because I learned about Bandy tonight. I'm learning about cartilage repair, and now I'm learning about Mr. Nobel?
Right. So the story I know on him, and I guess I'd have to do some fact checking here to be sure that this is it, but he was the gentleman who developed dynamite, TNT, trinitrotinitrate. And so he made a vast fortune with explosives in the 1800s. And he donated his money to this event and this honor for exceptional things happening in our society with the Nobel Prize.
Wow, that's great. That's a great fun fact. We actually have 12 shares on Facebook Live. I tell you, it's a big hit on Facebook Live. We have a question.
Yeah.
And if they're appropriate, I will ask them for the doctor. We got an appropriate one here. Nick Cavallo asks, can this procedure also be applied to other joints like the spine?
Yeah, that's great. Great question. And that's the reason the International Cartilage Repair Society was formed. There is a lot of cartilage regenerative medicine being done in the spine right now. It's not clinically ready for that yet. The joints that have actually been transplanted to date on a regular basis are knee and ankle. I've done a few shoulders with sort of variable results, probably 50-50, half did well, half did not do so well. It depends very much on the individual architecture of a joint. That with the shoulder joint, for instance, it's a very, very thin cartilage surface. It's only 1 millimeter thick, whereas in the knee, it's anywhere from 3 to 5 millimeters thick. So these very thin joint surfaces are harder to repair. And of course, the spine is such an intricate structure that there is a lot of work being done on the disc, and there's some work being done on the facet joints, which are more like articular cartilage in the spine. So discogenic work is the big thing, because that's the biggest problem that we face. And so both are being looked at in the spine.
Okay, thanks, Nick Cavallo. I'll give you a quick shout out at Nick Cavallo Marketing. I just found your Facebook page and I'm liking it. Thanks for the question for Dr. Minas. And check him out if you or your family members or friends ever have an issue, with the knee or any part of the body. Check out Paley Orthopaedic and Spine Institute. Great orthopedic surgeons there at St. Mary's Medical Center. I promised the tease before the break I was going to ask you who was a candidate for cartilage repair, which you kind of told us early on. So early on it was obviously athletes, and then I imagine it expanded to weekend warriors like myself. Like, I'm working hard all week, but on the weekend I'm trying to do as many activities as I can, fun in the sun. But now you're at the Paley Institute, which I know very well. Dr. Paley worked a world-renowned limb lengthening specialist, but they treat a lot of pediatric patients. So can this be done younger than the adult age?
Absolutely. And when it was first FDA approved in 1997, this technique, it was approved for non-pediatric because they hadn't done enough research in pediatric patients. Since then, we just finished publishing a long-term study on pediatric patients demonstrating 97% good and excellent results at 15 years after transplantation. So it seems like kids do better than anyone. They have such fantastic regenerative capacity that if they have a bad injury to their joint, that usually it can be reconstructed with their own laboratory-grown cartilage. So pediatric transplants do very well. The FDA just overturned that in December of 2016 when the new product, the third generation cartilage transplantation product called MACI was approved. And that's a collagen sponge with cells grown through it. And that's the technique that we have available for it now. And that's approved for children as well as any part of the knee. So things are improving in that regard for sure.
That's fantastic. And is the lab at St. Mary's Medical Center?
No, so it's commercially cultured in Boston. It used to be Genzyme. The company is now called Vericel. And they're a cartilage company and stem cell company. So they do cardiac stem cells, they do skin cells for burn patients, and they do cartilage cells for adults and kids. Mm-hmm.
And then they're obviously brought down here somehow if you need to do the surgery, right?
So when the biopsy's done, the tissue goes back where it's grown there, and then it's stored and frozen in liquid nitrogen. And then you get an approval for your transplant through your insurance company. 90% of the insurance companies in the country approve this technique on a case-by-case basis. And then you set up your operative day that you want to do. And the culturing in the sponge takes usually 3 to 6 weeks to do. And then they send the tissue down to the hospital for the day of surgery by FedEx. Mm-hmm. So it just comes shipped, and it's good. It's transportation time. When it arrives, it's good for 4 days. So the culture media, the conditions of the transportation is such that you have time to do this electively.
This is absolutely amazing, and everyone's going to ask me after the show, will my insurance take it? And thank you for answering that and going above and beyond, because that makes my job a lot easier. 90%, that's a great number. But that's better than 8 out of 10. Even.
It is better. But then the other thing to remember is this isn't a procedure for end-stage osteoarthritis, okay? So when you were saying, like, who's the right candidate for this, so, most of these are sports-injured patients who have given up sport because their knees are damaged. And now they are weekend warriors. And my average patient is 36 years old, anywhere as young as 13. My oldest patient, 64, when they were transplanted. And it's not so much the age, it's the status of the knee. How much cartilage is still left that I can work with? If an x-ray shows it's bone-on-bone changes, it's already too far gone. Mm-hmm. It's like I say, I can fix a pothole, but I can't pave the road. So, I can fix large areas of damage, but the joint still has to look relatively normal on an X-ray. Where it looks usually very abnormal is when you arthroscope it or when you take an MRI scan and you see the large areas of cartilage damage that are present. But it can still be very effective even in those patients. So right now it's the weekend warriors are a majority of my patients. The people who are doing, Fitbit and how many steps can I do, and
trying to get 20,000 on the weekend.
Exactly, and they're going to the gym and they're doing all these different intensity workouts and pushing themselves, and their knees swell up and they hurt all the time. Generally, that's because they have cartilage damage, and most docs still have an aversion to it because it's a technically sensitive procedure to do, and they don't like the challenge of doing it and the intensity of the recovery to make sure they follow their patients. But a lot of these patients are basically just abandoned, what I call palliative care. Instead of them just being fixed, they get scoped and washed out, they get steroid injections, they live with their pain, they wait for their eventual total knee replacement. That doesn't have to happen.
No,
they can be arthroscoped, evaluated, and transplanted. And yes, there's a downtime. And my patients, it's always inconvenient. My average patient age is 36. So what happens when you're 36? Prime of your career, usually starting a family. Usually you got too many commitments to even count. And but they make time. They arrange things at work. They recover, and they're grateful. And I have a lot of patients in that age group who do their other knee. So we have a lot of patients with both knees having been done.
You're describing me to a T. Those are my peers. That's near my age. So if you have any of these ailments, go at least check out Dr. Minus at the Paley Institute. Paley Institute, great place to know anyways. They have a podiatrist on staff. Mentioned Dr. Paley as the limb lengthening expert, world renowned, as is Dr. Minus. They have a foot and ankle surgeon, Dr. Lamb, who I'm trying to get on this show as well, a spine, Dr. Feldman. I mean, fantastic group. And they are at 901 45th Street in the Kimmel building in West Palm Beach. And I will give out Dr. Minus's number. Dr. Minus, we have about 3 minutes. I promise I get you out of here at 6:30. So I want to stick to that. Tell us about, knee replacements, total knee.
So from the imaging technology that we developed trying to image cartilage, we developed three-dimensional printing. And we eventually worked with some engineers, formed a company that does printed knee replacements, custom-made printed knee replacements. So the molds are printed, the femoral component is printed exactly to the shape of your knee the way it was before it became arthritic. And it's amazing technology. It couldn't have happened until the 21st century when the computing power of the computers we have now and the software development. So what is done is if somebody needs a knee replacement, the reason we developed this, again, is our young patients who need knee replacements. They have very damaged knees, too far gone for cartilage transplants, but now they're still in their 40s and 50s. And our goals were to remove much less bone, make a precise implant that fits only their knee precisely, give them excellent quality of life and patient satisfaction. And right now our patient satisfaction is in the high 90s with knee replacements in patients in their 40s and 50s. And we've never been able to attain that without custom printed knee replacements.
Wow.
So the technology, it's been an adventure going through cartilage resurfacing, cartilage imaging to make custom knee replacements. It's a continuum of care for young arthritics, which is my most enjoyable group of patients to treat because they're in the prime of their life and they're struggling and they do well.
I gotta ask you, is arthritis genetic? Because my grandfather had it really bad. I'm starting to get it. Obviously, I'm overweight, but still, for other reasons, can it be genetic?
Absolutely. We haven't determined the genetic basis of osteoarthritis, but we know that there is definitely a genetic component to it.
Wow.
You see it run in families, that is the big research that is going on right now is what is osteoarthritis? Because we know it's not just traumatic injury to a normal knee, because there's so many different types of cartilage. As a surgeon, when you go in and you see, like, this person's cartilage is outstanding and this person's cartilage is soft and it's fissuring, and yet they're the same age and both of them have been inactive. Why is this so different? And that's where all the research is going now, trying to figure out the genetic basis and the familial basis of osteoarthritis and how we can stop it.
Well, Dr. Minas, thanks so much for sharing everything with us tonight. Dr. Minas is an orthopedic surgeon. He's a cartilage specialist. He's a researcher. 901 45th Street, Kimmel Building, West Palm Beach is where his office is at, the Paley Orthopedic and Spine Institute. Check him out, paleyinstitute.org, and St. Mary's Medical Center. Number is 561-844-5255. That'll ring you right to Dr. Minas' office. Always like to add a curveball question in the end. What are your hobbies and passions outside of medicine?
It's outside of the indoors.
Yeah.
I love to be outside, so I enjoy just running and exercising outside. I love canoeing, kayaking, fishing,
Swimming.
swimming. I'm more of a sinker than a swimmer, but I enjoy getting out. And I played college hockey a long time ago, and I still enjoy getting out skating and playing pond hockey up north when I'm up there.
But you got to get what I'm getting to. Famous swimmer in your life? Your wife? Tell us a little bit about her.
Yeah, so my wife is Dara Torres, and she's an Olympian, and she's had both her knees transplanted.
Wow.
And by me.
Okay.
And
did she say you did a good job?
Well, she went for the 2012, and she missed it by 900ths of a second.
Oh, Dr. Minas, come on.
I know. That was at the age of 45, so she did
45,
pretty good.
though. Wow.
Yeah.
That's amazing.
So,
one of the greatest, if not the greatest swimmer, women swimmer in American history. So fantastic. That is great. Thanks for sharing that with us.
Sure.
Well, I know I said I get you out of 6:30 to 6:31, but listen, I really want to have you back on the program or come up your way and do it from there.
My pleasure. This is really fun, and I enjoy sharing what can be really exciting opportunity for young people who are injured and feel there's no hope, and there is hope.
I'm definitely going to check you out if I have one of those weekend warrior injuries. Again, it's paleyinstitute.org. Paley spelled P-A-L-E-Y, institute.org. Check out Dr. Tom Minas, and we'll be right back on the You and Your Doctor show.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor show, living a longer and healthier life. I got to call this the Orthopaedic Surgery Show because we just had Dr. Tom Minas on, and now we have new to the West Boca Medical Center, Dr. Mirylsa Colón-Martinez. Was I close?
Beautiful. I loved it.
Really?
Yeah.
Thanks for coming over
Thank
to
you for
the
inviting
program. I like to say it's an adventure of health because, we learn so much about a doctor's areas of interest just having them here. Now, am I right? Are you new to West Boca Medical Center? Because I got to tell you, I found one of your flyers on my vehicle because I work in the building right in front of West Boca Medical Center. Great flyer, by the way.
Thank you.
And I had heard about you. A peer of mine in the healthcare world told me a little bit about you. But are you new? You're not new to South Florida, but you're new to West Boca Medical Center?
I am new to West Boca, yes.
Okay. And tell me a little bit about yourself. So you're an orthopedic surgeon, but you have a unique specialty as well.
Yes. I am an orthopedic surgeon, board certified. I became certified in 2014. I have been practicing approximately 10 years since residency.
Nice.
And I'm not Doogie Howser.
No.
Thank you.
I was going to say 10 years. Yeah. You don't look like you've been practicing 10 years. That's great.
Yes. And I have a foot and ankle fellowship, which I completed at the Brigham and Women's Hospital program. It's affiliated with Harvard Medical School in 2008 and 9.
Very impressive. That is a great fellowship program.
It was good training, excellent training.
Wow. Now, so you specialize in foot and ankle, but really a lot of foot and ankle surgeons may tell me that it can go above the foot and ankle, right?
Well, I'm orthopedic, so I can see anything from here down. I don't see any bones in the face, but I'm trained to do all kinds of fractures, shoulder fractures, knee fractures, long bone fractures, hip fractures, replacements, different joints, arthroscopy, different joints. My area of expertise is like ankle replacement, ankle arthroscopy, cartilage restoration in the ankle, and deformity correction.
Well, I'm glad to have you on the show. I've always had issues with my ankle. I played football. I used to always turn them inside, and you're probably already going to diagnose this. And ever since when I sprained them when I was younger, probably 16 to 20, a lot of sprains. I even wore the high tops and had my foot tape, but you get stepped on, you get turned. And every once in a while when I'm walking, my ankle just turn. Oh, and it just, the pain.
We can see you tomorrow,
I can walk right over. You're right. You're my neighbor now at West Boca Medical Center, which is a great hospital, by the way. But my first question that I jotted down, and I will give your website out. It's orthowellnessmd.com. I actually memorized it because I've been living there the last few days researching you. So who is a candidate for total ankle replacement? Well, let's start first. What is total ankle replacement? Like, would I need that right away now, or is it something when the ankle's actually fractured or blown out? Okay,
so most people have heard about knee and hip replacements are some of the most common joint replacements that are performed. And the indication is arthritis. So the same way, or arthritis related to trauma or rheumatoid arthritis or any kind of joint degeneration. Is the same kind of procedure, but for the ankle. So we replace your joint surfaces with a metal and plastic implant.
Okay.
And the ideal candidate, even though there are some exceptions to the rule, the ideal candidate is older than 55, has a neutral ankle or an ankle with minimal deformity, has arthritis, obviously. You're not going to do it if they don't have arthritis. They have good bone quality. So people with osteoporosis would not be good candidate in the ankle because the implant then just sinks in the bone. It doesn't have good bone stock to support it. Also, if you have osteonecrosis or areas of dead bone, you're not a candidate for that. Ideally, non-smoker, good soft tissue envelope, meaning the skin looks good. There's no signs of infection or a lot of scarring around the proposed incision. And preferably no history of prior infection in the ankle.
I see. Why non-smoker? Does it affect the tissue in the body?
What happens is that smoking shrinks down the teeny tiny blood vessels that go to the bone and the skin.
I didn't know that.
So you have higher risk of wound problems and the bone not healing. And it also affects bone healing when you have a fracture, for example. You have a fracture, you're smoking, you don't know why it's taking so long for it to heal. It's because of the smoking cuts down the circulation to the bone.
See, everyone, another reason not to smoke. I mean, there's so many reasons, but I had never heard that. I'm learning so much tonight. This is great. We're here with Dr. Colón-Martinez. She is new at West Boca Medical Center, orthopedic surgeon, foot and ankle specialist. Now, I noticed your number is 954. So were you in the Broward County area for a while?
Temporarily, yeah. And I wanted to just maintain the number to keep consistency.
Yeah, definitely. You're on the line right there at Boca and I guess the Hillsborough area. So Palm Beach County and Broward County is what I was trying to say. So definitely it works. I know. I used to have a 954 number when I was a newspaper reporter. So let me go back to the total ankle replacement. How long is someone in the hospital for that? And the second part of that, everyone's going to ask me, how long is the recovery from something like that?
For the ankle replacement, you stay overnight, but some places are doing this as an outpatient procedure now. So you come out of the operating room with a block on the popliteal nerve, which is behind your thigh. You keep that block for 2 days at home, so you have no pain or very little pain, and you have a big bulky dressing. The stitches should come out between the week 2 or 3 after the surgery. At all this time, first 2 weeks, you're going to stay non-weight bearing, foot off the floor. And then once the stitches come out, you can start physical therapy and walking on a boot.
Okay. So that's pretty quick. I mean, you're out of the hospital quick, which is impressive. I got it. Kudos to all doctors that I have on the show. It's about getting that patient out of the hospital and back to their quality of life. And, even like with someone who has a busy life, expediting that process as quick as, possible if the doctor approves it. I
am all for quick recovery, quick return to play, quick return to activity. And nowadays we have so many implants and biologics that we can use to accelerate that process of healing. Even implants that go inside of your body to just keep repair of a ligament, keep it safe, so you can walk on it right away. For example, if you have ankle sprains, right? So if you need a ligament repair, back in the days, you'd have to stay off your foot for 6 weeks. Now you can walk on it right away.
Right away.
Because there's more stuff that we can do to keep that repair safe while you're healing.
Yeah, and I've told that story a few times on the show. I've been doing this show for about 2 years. It almost feels like you step in a hole, and it just turns so quick, and I just hate that feeling. So I may have to actually come see you, or maybe a patient from the show. Tell me a little bit about flat foot reconstructive surgery. So I'm using myself as an example. I'm in the studio here. I actually have a pretty big arch. I used to play basketball, believe it or not, when I was very young, and as well. So I've never had the arch kind of sink yet, but there can be a flat foot arch, and if so, that can be reconstructive surgery.
Yes.
It can be an option to fix that?
Correct. There are several causes of flat foot deformity, which is when your arch falls down, and sometimes the toes start pointing to the side. A lot of people complain of swelling on the inside of the ankle and pain in that area. The most common cause is failure of a tendon around the ankle in adults, called the posterior tibial tendon, but there are other causes as well. And they can all be treated non-surgical, without surgery, and with surgery. With surgery, we make several bone cuts and transfer tendons around the ankle to realign the foot.
I see. Okay, and how's the recovery time from that?
So for that, it is typically 4 to 6 weeks non-weight bearing in a boot or a splint.
That's not too bad, yeah. Non-weight bearing in a boot or splint. Okay, and now another question I wanted to ask you about, and the website is orthowellnessmd.com. You're wondering if you're listening on the radio or viewing on Facebook Live, All County Healthcare Incorporated. It's Facebook Live page, which you can get the show there anytime, or allcountyhealthcare.com as well. Yeah, thank you. We are live. We have 27 shares on this program, which is great. If anyone has any questions, the doctor will be here till 7, or you can call in at 1-888-565-1470. There were so many different ailments and areas of interest that were on your website, so I kind of grabbed a lot from the foot and ankle, and I want to talk to you a little bit about... and I'm going to totally get this wrong. Is it Pes Cavus and Charcot-Marie? Pes Cavus,
yeah.
I was close, actually.
So Pes Cavus, cavus sounds like cave, so it's a really high arch foot. It's the opposite of a flat foot.
Huh.
Really high arched.
I never thought of that can happen as well.
Pes Cavus.
Is that tied to the ligaments as well?
It tends to be more of a bony deformity.
Okay. And you can actually improve that with surgery
as well. Yes.
And these, I should mention, these are minimally invasive. Like you're going through a very small area.
Yes.
For women, maybe you can least scar.
I have to say I am one of the very few in South Florida trained in no scar foot and ankle surgery with new instruments that just got here, just approved by the FDA. The company just got them here like this year. I was trained in 2016, even before the instruments were here.
No scar. That's great news.
Scar.
That's great for men and women because we're trying to get to the beach and whatnot as well. And I'm thinking like, if I have to have that ankle surgery, there's going to be that line. You know what I mean? Because we've all seen them. Maybe we had friends or family members who had surgeries a year ago, but you can do no scar.
Yeah. Not all of what I do, right? But
not all
as much as we want to do minimally invasive because also it's not just a cosmetic result, but we also protect the soft tissue envelope. It's not the same thing me cutting open a 7-centimeter incision and all the blood vessels feeding that skin, they get caught, right? Versus me not disturbing that circulation at all and doing everything percutaneously. The healing is much faster and much more effective.
Oh, that's great news. And tell us, everyone, about your office. So it's right there at West Boca Medical Center? It's
at West Boca Medical Center in the 9970 building, Suite 402. My practice is it's a different experience in orthopedic care. It's more personalized. You come in, there's music playing, there's aromatherapy. We even have a massage therapist coming on Mondays. It's more personalized, and you even get a goodie bag as a new patient when you come in as appreciation from us to you for choosing our practice.
Oh, nice. That is a great feature as well. And I'm actually going to blow right through the commercial break here. I'll do it here. All County Healthcare. Check them out. They are a Medicare certified home health agency. Check them out. It's 1-888-717-7170. There we go. Because we're having such a great conversation, I want to get to a lot of the other things that you do as well. Now, I've actually researched Charcot-Marie tooth before. Isn't that a neurologic disorder?
It's a neurologic, hereditary neuropathic disorder.
Okay, but so the neuropathic, that was the key word there, because it can travel down through the legs, through the nerves to the feet?
It's a different kind of nerve disorder because it's genetic, and it starts in the teeny tiny muscles in the foot, and it raises up. It affects the motor nerves more.
Oh, I see.
So these people tend to have a pes cavus deformity and weakness in the peroneal tendons, so their ankles roll outward, their legs, their calves atrophy, so they get very, very thin. So they have weakness from that, and that's another. It's very rare to see it, but we can help them as well.
Well, you never know. We've had people chime into this show from London, from New York City.
Wow.
Had a doctor once had a patient come from Indiana after the show. So you never know, because we're on iHeartRadio app and Facebook Live as well. So you can do a reconstruction for the Charcot-Marie tooth. That's a reconstruction surgery. Okay. Now, what actually is foot drop? That's an interesting term. I don't think I've ever seen that term.
Foot drop is when your foot cannot lift up, take off, for you to take a step. So some people drag their foot. Some of them slap it to the side. This can come after hip surgery, trauma, a hip dislocation, just neuropathy.
Okay.
But those are the most common scenarios. It can also happen from, for example, if your tendons are cut, the ones that lift your foot up, you're not going to be able to.
No, you're not going to be able to.
Right? But is more commonly due to a nerve problem.
Okay. And you're able to correct that as well.
We can fix that too with surgery.
Through surgery.
Yes.
So, Dr. Colón-Martinez's office, like she says, 9970 North Central Park Boulevard, Suite 402, on the campus of West Boca Medical Center, where she is on staff as an orthopedic surgeon and foot and ankle specialist. The number is 954-251-6051. The website is orthowellnessmd.com. Ton of info there. Great website. Great job on that. And you can email orthowellnessmd@gmail.com. Smart to keep your website and your email very close to the same. I like that. Now, fusion surgery, I've heard a lot about that with spines. We've had spine doctors on here talking about spine fusions. You can do it with is it the foot and ankle?
Yes, when we talk about fusions, we're talking about a joint. We're talking about eliminating a joint. Some joints are not candidate for replacements, especially in the foot. Like now, we have an ankle replacement and maybe a great toe or the hallux big toe replacement. But there are other joints that don't move a lot and there's no replacement for that. So what we do, if there's arthritis, we do a fusion surgery where we go in, we take down remove all the cartilage, prepare the joint surfaces, and put the bones together, deleting that joint and crossing in screws or plates or whatever to make those two bones become one. That eliminates the motion, but it eliminates the pain. And there are specific degrees and specific alignments in which the bones are positioned so that your foot can be functional.
Okay. That seems like a little more intricate surgery, the fusion. Does it take longer?
It depends who's doing it. I have to say that I had excellent training at the Brigham at Harvard with Dr. Chris Kyoto, Dr. Mike Wilson, Dr. Eric Blumen, who are world-known surgeons. They really taught me how to prepare, like some of the reps here have seen me do. They say that I prepare a mean joint. Like, it's just, it's legit. It's going to heal. The fusion rate is 94%, which is excellent.
Wow.
It's usually 85 to 90, but they got it up to 94%.
Great numbers.
Yes, and now we have biologics also, which add to the equation to increase the bone cells migrating in the area and making the fusion happen.
Well, thanks so much for teaching me so much about the foot and ankle. This is one term that I do know about, as I grew up as an athlete, is the Achilles tendon, and when that ruptures, that can be, I've never had it rupture, but I've seen it on TV. I've talked to people who've had it very painful, right? Almost like a trauma in a way, right? Is it a trauma?
It is. The Achilles problems is one of the things that I see most commonly in the office. I actually have a publication, a paper written on a technique tip on how to do it when you do Achilles surgery, which was published at Foot and Ankle International Journal. And a rupture of the Achilles, it's very serious. Not always is treated surgically. There are patients and there are patients. Of course, if you're older, less active, have higher risk for surgery, then it's preferred to not do the surgery because your functional level is going to be lower. But if you're young, active, and you want to stay active, you should do the surgery. The sooner the better, so you can recover faster.
Okay. That's what we see a lot of athletes will have it almost right away as soon as possible,
Yes.
so they can get back to, obviously, their sport. But like you said, if someone's younger, quality of life, getting back to that, like I said, weekend warrior, if they play intramural sports or sports in clubs or the community on the weekend, it'd be quicker to get back as well. Now, we talked a little bit about the no scar surgery, and I just think that is fascinating just thinking of it, because I know you can't do it with every single ailment, but for most, right?
Yeah, especially for bunions, it's fantastic.
Okay.
I mean, if you have a bunion and you're a woman and you want to wear heels and you show your toes and your pedicure, and then you're getting a scar, you know what I mean, after you have the surgery. So
Yeah, you don't
this
want
will
that.
correct your deformity and leave no scar, basically.
Yeah.
We do the toe deformity also, and then the other joints and the arthroscopy.
Tell me, are bunions most to do with in women from wearing high heels, or is it other?
It is a predisposing factor. I have to admit that I am a victim of the high heels also. Like, I love them.
But you're a foot and ankle specialist, so what are you doing?
But I'm a girl too.
Yeah, definitely.
So what I do is I don't wear them often. As you see, I'm wearing clogs now. I don't wear them often, and I wear them for the entrance, for the exit.
Yes, special occasion.
Yes, special occasion.
Fine dining.
Right.
That kind of night. So we only have 2 minutes. These are two terms I definitely wanted to get to, and then we'll definitely have to have you back on the show anytime you like.
Yes.
This is amazing, and you're at West Boca Medical Center. So less than 2 minutes, say a minute. Trigger point injections, what are they? And then follow up with that, ultrasounded guided procedures.
So trigger point injections is when you have a muscle spasm, you can put medication right in the muscle and stimulate the muscle to bring in more circulation in the area. And the ultrasound guided injections is to be precise with the injection that you're going to get in any body part, basically almost any body part. If you're getting an injection in your elbow or your shoulder, you want to be precise where you put the medication, and the ultrasound guides us.
Now, can those injections be done in your office, or are they done at the hospital?
They are done in my office. We also offer regenerative medicine, platelet-rich plasma, amnioplacental tissue matrix, which is fantastic for degenerated tendon, and stem cells, and holistic approach, and much more.
My listeners will know PRP. We've had a few doctors on here about that. But, yeah, regenerative medicine, they can check you out. And, again, it's Ortho Wellness, 9970 North Central Park Boulevard, Suite 402, right on the campus of West Boca Medical Center, Palmetto Park Road and 441. OrthoWellnessMD.com. Check her out, 954-251-6051. It's Dr. Colón-Martinez. And please come back to the show. This was great.
I will. If not, I'll come in and then examine you.
And definitely. And she's bilingual, English and Spanish. Thank you for joining us.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle.